Fatty liver disease is a disorder in which your liver becomes clogged with fat. If left untreated, liver inflammation and enlargement can lead to various health issues, including high blood pressure, diabetes, renal disease, and an enlarged gallbladder. Toxins can accumulate inside the tissues throughout your body when the liver is eventually damaged to the point that internal scar tissue known as fibrosis begins to form. This prevents the liver's cells from purifying your blood. Sadly, consuming the improper meals causes fatty liver disease in about 25% of adult patients globally. Eating excessive amounts of omega-6 vegetable oils, such as margarine, cottonseed, maize, soy, or canola oil, might be one of the primary culprits because they irritate the liver cells, which stops fats from being digested normally. Eating too many sugar-filled meals can also contribute to a fatty liver since they are transformed into free fatty acids, which can block the liver. Alcohol use is another factor, since it sets off specific genes that instruct your liver to store fat rather than burn it. High-fructose corn syrup's rapid conversion in the liver to fat is another issue. Sadly, in order to improve the flavor of packaged foods, especially carbonated beverages, sauces, and fast food, more than 80% of them include this ingredient. In less common situations, liver injury by medicines, treatments, or even viruses may result in the accumulation of fat. The symptoms of fatty liver disease might go undiscovered for years until the liver sustains severe damage. It typically does not appear on a liver enzyme blood test. In this video, I'll go over the top 8 signs of fatty liver disease. I'll also discuss 6 natural remedies to heal a fatty liver. Make sure you don't miss anything important by watching all the way to the end. Right shoulder discomfort is the first sign that you may have a fatty liver. A fatty liver may be the cause of any discomfort or stiffness you experience in your right shoulder, neck, jaw, or under your shoulder blade. Bile, a fluid produced by the liver, aids in the digestion and breakdown of fats found in foods like meat and olive oil. However, excessive fat congestion in the liver can cause the bile to thicken and become caught in the small tubes, inflaming and swelling the liver. Your upper right back or neck muscles may experience referred pain as a result of pressure being applied to the phrenic nerve, which travels up your right side. The second and most prevalent symptom is abdominal fat. If you have a huge pot belly or a lot of fat around your abdomen, it's likely that you have a fatty liver. Fat begins to gather inside the liver, and when there is no more space, it spreads and transforms into visceral and subcutaneous fat surrounding your stomach. The most harmful type of fat is visceral fat because it becomes lodged around your internal organs, preventing them from functioning normally. This can cause blood pressure to rise and even induce a heart attack. It's crucial to remember, however, that visceral fat surrounding your organs may occur without you ever realizing it, and you don't need to have a pot belly to have a fatty liver. Spider veins are the third sign. Because the liver is unable to filter out extra hormones, those with liver impairment have greater amounts of estrogen. Increased estrogen weakens your veins, causing little spider veins to form on your skin. These often feature a red dot in the center with reddish tendrils extending from it. Excess breast tissue is the fourth sign. That greater quantity of estrogen that I mentioned before can accumulate and trigger male breast tissue development in men with fatty livers. Usually, there's a lump of fat tissue directly under the nipple, and when you touch it, it hurts and gets uncomfortable. Before we go on to the next symptom of a fatty liver, please like this video and subscribe to our channel. We can continue to help more people by producing these free health videos thanks to your support. The fifth symptom is an enlarged right foot. One of the most typical indicators of liver damage is if you observe that the swelling in your right foot and ankle is greater than that in your left. Because the swollen part of your foot is loaded with fluid, pressing your finger into it may create an imprint. This condition is known as pitting edema. Your liver's inadequate blood flow is the reason for this swelling. The sixth symptom is itchiness in the hands or feet. As pointed out earlier in the video, a fatty liver can get clogged and back up with bile. Histamines can build up in the blood when this bile liquid begins to seep out and collect beneath the skin. These set off an allergic reaction that causes you to scratch the palms of your hands or the soles of your feet. The seventh symptom is hypothyroidism. If you've been diagnosed with hypothyroidism, keep in mind that it's commonly the result of liver damage. The hormone produced by your thyroid is known as T4. Inside your liver, 80% of this is activated and transformed into active T3. But if you have a fatty liver or cirrhosis, this conversion might be blocked, resulting in a low-functioning thyroid and metabolic issues. Constant exhaustion or sluggishness is sign number 8. Fatty liver is really one of the primary and most prevalent causes of lethargy, despite the fact that fatigue can have many diverse reasons. Absorption of fat-soluble nutrients from meals, such as vitamin A, E, D, and K, and plant-based carotenoids, is hampered when the liver is overloaded with fat and it does not secrete enough bile. This will cause your body's antioxidant levels to drop, making you always feel exhausted and lethargic. Therefore, it is strongly advised that you see your doctor and request an ultrasound exam if you experience a combination of these symptoms. This is the most basic test that physicians perform on expectant mothers. It takes a picture of your liver and its network of blood arteries using sound waves to determine whether or not fatty deposits are accumulating inside the organ. Thankfully, the liver is one of the few organs in the body capable of full regeneration and healing. Let's now look at 6 lifestyle adjustments you can do to assist your liver get rid of all this extra fat and heal itself. Make sure you don't miss anything important by watching all the way to the end. 1. Eliminate inflammatory vegetable oils such as processed olive oils, margarine, soy oil, maize, cottonseed, and canola that are harmful to your liver. You should start preparing your own nutritious meals at home using healthy substitutes like organic raw coconut oil, extra virgin olive oil, and cold-pressed avocado oil, as fast food and packaged goods are frequently cooked with these inflammatory oils. The healthier oils are full of nutrients, such as vitamin E, which aids in the breakdown of liver scar tissue. 2. An hour before every meal, begin taking a high-quality digestive enzyme supplement on an empty stomach. Verify that the brand you select has betaine hydrochloride and purified pancreatin in the ingredients list. These enzymes assist in thinning down your liver's bile, allowing it to break down extra fat and cleanse the organ. Additionally, I suggest consuming 300 milligrams of CDP choline once each day. Choline aids in enhancing the quality of your bile and eliminates fat from your liver. 3. Reducing your intake of starchy, sugary, and grain-based foods, such as sweets, bread, biscuits, pasta, rice, and potatoes, is crucial. Swap them out for anti-inflammatory foods like pasture-raised eggs, grass-fed meats, and wild seafood. These proteins are also high in substances called choline and lecithin, which effectively reduce liver fat. Along with cruciferous vegetables like cauliflower, broccoli, radishes, and Brussels sprouts, it's also advised to consume a lot of organic vegetables high in sulfur, such as garlic, asparagus, onions, and leeks. The meals high in sulfur assist your liver produce more enzymes that aid in fat breakdown and the removal of toxins from your body, such as alcohol. 4. To aid with liver detoxification, take 150 milligrams of milk thistle extract 2 or 3 times a day. This plant is abundant in silymarin, a substance that increases the production of glutathione. Your liver produces glutathione, the ultimate antioxidant that helps to repair and rebuild liver tissue as well as control inflammation throughout your body. 5. You must quit eating often throughout the day to give your liver enough time to break down any fat in order for it to truly mend and recover. An excellent method for doing this is intermittent fasting, in which you consume all of your daily calories within a 4-hour period, then fast for the remaining 20 hours. When you fast, your liver begins a process known as autophagy, which allows it to recycle broken proteins and scar tissue into new, functional components and cells. Keep in mind that not everyone can benefit from intermittent fasting, particularly those with certain medical conditions. Always consult with a healthcare professional. 6. In order to address fatty liver disease, normalize blood sugar levels, and improve nutrient absorption, begin consuming 1 tablespoon of apple cider vinegar and 2 tablespoons of raw lemon juice mixed with 2 cups of water each morning. This should be taken without food. This beverage is high acidic, citric, and vitamin C content, helps to remove fat from the body and encourage the liver to release more bile. If you have a fatty liver or digestive issues, this is a natural remedy I routinely suggest. We really hope this video was useful to you. Before you leave, please like this video and subscribe to our channel. We are able to keep producing these free health videos thanks to your support. Stay healthy and take care. Click on our channel logo shown on your screen to subscribe now or watch this other health video.